Baby-friendly USA has typically been, it's a intimidating mountain to hurdle. We have gotten very good at handling a very large volume, a very large patient census, and unfortunately that lends itself to a nurse and doctor-centered model of care. We like to check things off of our list and take care of our patients the best way we know how and the most efficient way that we know how, and a lot of times mother-baby couplets together time and their wishes and desires for their birth experience sort of inadvertently fall to the wayside.
So I think it's important that all hospitals be working toward baby-friendly because it's about honoring the mom and the baby and their family's choice. Even if a mother decides to breastfeed, that means that the hospital is honoring that decision, and they're going to do everything in their power to empower that woman and that baby to work toward that choice.
It seemed like a lot to take on right now when we have a lot of new initiatives coming through the hospital. We've been working on changing our model of care to a patient and family-centered care, which falls in line with Breastfed Beginnings and the Baby-Friendly USA designation.
That's all good.
So I think if we do things step by step and not, try to hound the staff with so many changes at first, I think it's going to work really well. We've had really good success with our first few cycles of changing from the assessment nursery, doing the assessments in there, to actually doing them in the room, and patients and staff have showed a lot of satisfaction because they're getting all the information. Mom's getting to see baby as they do the assessment. So I think if we work in small steps, it's going to be really successful.
They're not going to listen to me saying you should do this, but they might listen.
I've had a small group of comrades along the way that are equally as excited, and we keep each other's spirits up when barriers start to show up.
Would love to get to the point that we can do exams in the room so long as we can get the lighting issue taken care of.
Baby-friendly and Breastfed Beginnings has changed our focus to really fight for a good latch and another breastfeed, and problem solving with that, providing mothers more chances to do skin-to-skin care and having that help breastfeeding. We don't send them home. We're working on not sending them home with those free formula samples because it gives them an easy way out of breastfeeding when prior to their birth experience, their decision was to breastfeed. So in a way, it's dishonoring the decision that they made as a family before they came into our hospital experience. It gives you tools and help along the way. It also puts you in collaborative groups with other hospitals across the nation so you can bounce ideas off one another. I can contact other hospitals of similar volume and census and ask them about their ways of getting around barriers, and we can share our newfound improvements with them.
When I wanted to hold my baby right after the baby was born, I was one of those difficult moms. I was one of those crunchy moms. When I wanted to, breastfeed right away before they, when I wanted to do all of those those were my choices as a mom, and that was considered to be difficult. It was considered, oh, one of those moms, And now, that's the way we do it.
I think change has been in the past a way of saying you're not doing something correctly, you're not caring for your patient in the best way. We're doing our best now to feature this program as an even better if to your care. You're doing great things, but wouldn't it be even better if we could get you at the bedside more and we could have you, one-on-one care with that mom for more time?
Yes, he's got a Kirk Douglas dimple. He is very content because he just had his breakfast and he is sleeping.
Started working here, I felt that mothers, at least in surgery during C-sections, don't have a lot of time with the baby before they get to the recovery room. So when they brought this up to me, I thought it was a good idea, and I wanted to try it out and see how sharing space at the head of the bed with dad, mom, baby, the nurse, the baby nurse, and me would work out. Not everybody initially adopted the idea for sure. When I sent the email out to tell them that this was coming and that they should be expecting this process, I had a few emails back saying that it's really unsafe and all that.
We had people that didn't want to do it, and I think for them it was hard because the nurses were used to doing things a certain way. The baby nurse came in, was in a period of time, and they did all their little procedures at a certain time, and then that baby nurse could leave. And so they were used to doing things a certain way, and so they had to completely reorganize. I really give them a lot of credit because, especially when you feel so confident doing a certain way, to have to change and do it a totally different way.
After we started this program, I've noticed that the anxiety in the mothers completely go away, and both mom and baby are very peaceful together. Those first few minutes,
Baby.
I think, is the most beautiful picture.
And it is a boy.
As the baby nurse brings the baby over, we just kind of lift the blankets and the gown, and the baby nurse just put the baby on mom.
The mother and the father really, really appreciated it. And the first mom that we did, she just cried, and she said, I thought I was going to not be able to have this experience, and to have that experience just made her birth experience just really worthwhile.
The only thing that I would tell my partners to try before they comment is that without doing it, you don't really know how good it is for the mother and the father as well to see that, to be in that moment together, the first few moments of life.
We have lots of people who've been taking care of babies for a long time, and they're convinced that what they're doing is the right thing, and it's not a wrong thing. It's just that things are changing.
The biggest obstacle, I think, right now is the number of people that are involved, and the fact that we have to reach so many different people on so many different levels to get the education out there about what we're trying to do. Not force breastfeeding down anyone's throat, but to support the people that choose that for their babies.
Some of the myths that we've encountered with just establishing breastfeeding in general and the baby-friendly process is that a lot of the staff feel that we are not ever allowed to give the babies a pacifier. They also feel that that becoming baby-friendly is forcing moms to breastfeed when they don't want to. And so, we're trying very hard to dispel that myth.
The pacifier use, a lot of times they think they're doing the mom a favor by giving him the pacifier so that mom can get some more sleep. And we have to educate them that yes, there's a time and a place for a pacifier, but we're hoping it's once breastfeeding gets well established.
Oftentimes the nurses will feel like the baby's crying or the mom is saying that the breastfeeding's not going well. They'll worry that the baby's not getting enough fluid or enough formula. They don't understand how small the baby's stomachs are and really how much of the babies can compensate.
We think part of the process in moving forward is to make sure we get all the obstetricians on board with us, that the communication and education of the moms doesn't start when the baby's born. It should start early in pregnancy or even before pregnancy. And all their obstetricians are committed at one level. We're trying to get them totally committed and to start being very enthusiastic about pushing breastfeeding from the preconceptional visits and through all the prenatal visits.
What they need to realize is that their patients look to them as the authority, and their patients are going to look to them for advice and counsel on what to do.
There are way more people that are incredibly passionate about this process than I ever anticipated. So for me, that's been encouraging. And I think we just need to use those people as the champion to spread the word about what this really means and how beneficial it is.
When we finally make baby friendly, we'll start off with a big party with hats and loud noises and bragging to the community. I think we will brag. I think we're going to get the newspapers and local TV stations to come and celebrate with us. It continues to be a process, though. It's not like we get to the finish line and the race is over. We still have to continue educating and working within families and to keep up when we succeed.
You ready for that? Yes. This is not what's going to happen. Yes. Yes.
I think there are a number of factors that impact the breastfeeding rates here in the state of Alabama, and I know that that would encompass the South as well. The culture here may not have always embraced breastfeeding as being the best source of nutrition for babies. There are people who believe that the breasts are not necessarily intended to provide nutrition for babies.
When we saw the breastfeeding rates as low as they were, it was kind of a challenge internally to us that we weren't, when we looked at some of our peers across the country who were doing much better, like we should be there, we can be there, we are that great.
Our first reaction, I wasn't sure what all it entailed, and we had heard a lot of rumors about no formula or forcing people to breastfeed, which is of course not at all what the program is about.
It has to be more than one department. It has to be a team, and that's really been the key to our success. Is that we've got great team players here, and they've jumped on board. I think one of the unique things about UAB Hospital is that we have such an impact in the community, and because we have a big impact in the community, we've been able to bring in key leaders from other places around the community. We have members on our leadership team from the WIC office, from the health department, for example. Those are real advantages to us. We have private physician offices, we have the health clinics. So that makes a big difference when you've got a broad base to your leadership. I think the value of NICHQ is they are really keeping us on track. And the collaboration that we're able to have with other hospitals, I think in the process has been very valuable. Taking some of our leadership team to meet with the leadership team with other hospitals has been extremely valuable, because I can say things and I can bring literature, but when the doctors go and talk to other doctors and other hospitals that have done this successfully, it really has an impact.
It needs to be encouraged prenatally, not just when they get to the hospital. If they're encouraged by their pediatrician when they go meet their pediatrician, if they're encouraged by their OB, the best time to think about it is not when the baby's born, because you got 500 other things going on. The best time to think about it is the 9 months while you're pregnant to get involved.
We've had tremendous positive patient feedback. I get calls and cards on a regular basis telling us what a difference we make. It really makes a difference for these moms when they have someone to support them in this process. Many of them come into this thinking, I don't know if I can do this. They have doubts about their own ability, and they need someone that's just holding the hand and saying, you're doing a great job.
With us being involved with the NICHQ project, it gave us the opportunity to reach out to others who probably have hit some of the same bumps and snags to work those out. So we're still working out kinks. I think that we are definitely on our way. So far, so good. And I am looking forward to the second half, and I'm looking forward to becoming designated as baby friendly.